Dorian Gregory is an actor, producer, and musician. Diana Avena runs marathons. Bob Jacobman and Eva Barquero are active adults. Tatum Kessel is in school. Pierre Ali is pregnant. They look very different, but they have one major thing in common: diabetes. It's an American epidemic. These are the challenges they face and the breakthroughs that are saving lives. I'm Dr. Bruce Hensel. The numbers are staggering. 24 million Americans now have diabetes, a 61% increase since 1990, a 3 million increase since 2006. 57 million have prediabetes. That can lead to the disease. But worst of all, 6.2 million do not know they have it.
I want you to meet somebody.
Dorian Gregory leads a supercharged life, acting on TV shows like Charmed, hosting Soul Train and The Other Half,
Baby, can't you see?
and composing and producing music and movies. All while handling one of the most severe forms of diabetes since he was only 9. Dorian's first symptoms were subtle.
I was just feeling sluggish. I was feeling not quite on point.
The next day, that began to change.
I just started throwing up like crazy, like just nonstop.
Within hours, it turned life-threatening. Dorian lost consciousness and he was rushed to the hospital.
I was in a coma for 3 days. Doctors had no clue what I had. Intern stumbled on me and smelled my breath. And he said, "This kid's got fruity breath. Check his blood, he's probably diabetic."
When non-diabetics eat, sugar goes into the blood, and that stimulates the pancreas to release the hormone insulin. Insulin helps the sugar get out of the blood into the cells, where it's used for energy. In Dorian's case, type 1 diabetes, the body no longer makes insulin. Sugar cannot get into the cell. It builds up in the blood, causing weakness, increased thirst, and increased urination. Without treatment, brain cells don't get the sugar they need. Patients lose consciousness. Other sugar-starved cells start to burn fat, leading to an acid buildup that can quickly cause death.
If that intern had smelled my breath, I would be gone.
Once the diagnosis was made, doctors gave Dorian insulin by vein. He woke up quickly. His family realized their lives had changed forever.
I looked at myself and wondered what I had done, and of course, I hadn't done anything.
Father's supposed to be protective, supposed to be able to take care of things. And this is one case where you're 100% helpless.
That's how Dorian's sister, who performs with him, feels about him having diabetes.
I wish he didn't.
The family moved past wishes to empowerment. The first thing they learned, it was no one's fault.
We know that there's a genetic predisposition, likely some environmental trigger that sets it off, but then the body gets confused, thinks it's attacking a virus or a bacteria, and then starts attacking their own pancreas.
Have you been feeling?
I've been feeling great.
Dorian's doctor warned that over time, high blood sugar may damage blood vessels and increase the risk of heart attack, stroke, blindness, kidney disease, and other organ damage. The family quickly learned how to prevent those complications.
Definitely believe as a family that the family has diabetes as much as the person who has diabetes.
They began counting every calorie, measuring every carbohydrate.
I bet you it's like 130 something.
108. 128.
Dorian checked his own blood sugar 6 to 10 times a day. In the old days, that was very difficult and sometimes dangerously inaccurate. But then, one after another, came the testing breakthroughs.
When I was a kid, you had to pee in a cup and you had to stick a pill in it and then compare it to a color chart and wait 5 minutes to see what your blood sugar was 2 hours ago. Then it went on to the blood testing machine, which also took 2 minutes, but it was more accurate.
Now an almost painless test that takes just 5 seconds.
Ooh, yeah.
We need a shot after this. 160.
New, longer-acting forms of insulin give Dorian better control and more freedom.
I'm a human being. I want to eat like everybody else.
Over time, Dorian became an advocate for others who do not understand the risks of diabetes, which may be 2 to 4 times higher among African Americans, Hispanic Americans, and Native Americans.
So we're very much concerned about diabetes for African Americans as well as Native Americans. We happen to be both.
Since the disease can strike anyone of any age or any ethnic group without warning, we all need to check with our doctors to see which tests are right for us and when.
But the key is knowing your body.
Dorian is living proof that diabetes can be handled. Handled properly, diabetics can lead vibrant, healthy lives.
Well, 128. Good stuff. Let's go.
I've taken the journey. As a kid, as a teenager, young adult, I rebelled. It doesn't work. Look where I am now. Nothing's impossible.
Coming up, the challenges elementary school children and high school teens have to face. The breakthroughs that are saving their lives.
While the diabetes epidemic is affecting all of us, the hardest hit may be our children. Dorian developed it at 9. Some children get it even earlier, and that presents unique challenges and a need for unique breakthroughs.
I would like to be like everyone else. I don't really like to have diabetes.
Caden Kessel developed type 1 diabetes when he was only 3.
It was totally unexpected.
To be told that your child has diabetes, we had a lot of sadness, and it was very intense.
Because of his age at the time and the severity of his diabetes, shots were not the complete solution.
We had to count we still do have to count every single thing that goes into his body that has carbohydrates.
He had to have 30 grams of carbohydrates exactly for his 3 meals a day, and then 15 grams of carbohydrates for his snacks. We can't just check him into daycare or check him into different things. He can't just go off to summer camp. He can't, without someone who's trained nearby.
The breakthrough solution? The insulin pump.
It's got a little catheter into your skin. It's giving you insulin all the time. And when you go to eat, you decide how much am I going to eat, how much insulin do I need to match that food, and you dial in a different number, and it gives you what we call a bolus to cover that meal.
What's special about my pump is that without taking shots, I can just enter the grams, just like done.
Done with much better control of the diabetes. But there's a problem. Caden wants to be a professional football player. He cannot wear the pump when he plays.
3 days ago, KK was in tears, just sobbing, saying, I hate diabetes, I don't want to have diabetes. You're never going to find a cure, they're never going to cure it.
I would do anything if we could actually find it.
That's how 12-year-old Diana Avina feels.
She's a fast runner. This is a gift that she has. Next thing you know, I hear from her, I'm running a marathon.
I did it. I actually ran the marathon and I got my medal. I was so proud of it.
All done despite diabetes. Diana's treatment started with insulin shots.
3 times a day?
At first, the shots kept her blood sugar from getting too high. Then one day, an event every diabetic family dreads, an insulin reaction. Diana's sugar got too low. She had a seizure.
I saw myself lying, like I couldn't think, I couldn't do anything. Like I heard voices around me.
I was afraid of losing her. I was afraid that one day she was not going to wake up anymore.
That's when Diana's mother decided to get the pump for her.
It's actually connected to my stomach.
She also enrolled the whole family in diabetes classes.
The biggest challenge was having her mother believe that she was going to be okay.
Chicken has no carbs.
Diana believed it right away.
She would ask, can I eat Pop-Tarts, yes or no? And I just thought, wow, this child is so proactive. She's just a remarkable child.
I'm very proud of her. She knows how to deal with her diabetes. Whether I'm there or not, she can do it.
Since I have diabetes, I'm always going to have to deal with it, so why be mad of it? You have to keep on going, chase your dreams, nothing can stop you. Just remember, you only live one life. Make the best out of it.
Later, how Caden made the best out of it in our nation's capital. Next, a different form of diabetes, type 2, affecting adults, teens, and pregnant women.
This is Pir Ali's first look at her new baby. It's a happy time, tempered by what her blood sugar test showed.
2 of the levels on the test were abnormal, And when that happens, they know that you have gestational diabetes.
Up to 15% of pregnant moms can get gestational diabetes.
Unlike type 1 diabetes, where the body doesn't make the insulin it needs, in type 2, the body makes various amounts of insulin, but the cells resist its action. The results? The same as type 1, dangerously high blood sugar. In gestational diabetes, the cause may be the pregnancy itself.
The placenta secretes hormones, and at around 24 to 28 weeks, the increased hormones that are secreted interfere with the insulin that's being produced by the mother, making that insulin less effective.
The mother and the baby don't get the sugar they need for energy. That can be very dangerous for the baby.
They could suffer brain damage. They could suffer nerve damage.
2 servings of starch, 2 ounces of meat, and 1 serving of fat.
The first step, education.
When my blood sugar is 200, my baby's blood sugar is 200. Could you imagine a baby trying to metabolize that much sugar in their system?
If you put plenty of pressure against your finger and then press here.
The second step, regular testing with breakthrough monitors to pick up the slightest change in mom or baby.
It's considered a high-risk pregnancy. Moms are going to have to get their ultrasounds. They're going to have those non-stress tests where they monitor the fetal heart tones.
The third step, learning how to eat and live right for 2.
My daughter is going to have to fight this fight if I don't do it right.
If Pierre does do it right, it's unlikely her daughter will get diabetes. But millions of other children and teenagers develop type 2 for a different reason. They just gain too much weight. In this case, it's not a blocking hormone like in pregnancy. It's the cells themselves that resist insulin. 17% of American children are now considered obese. 33% weigh more than they should. This weight boom has contributed so heavily to the epidemic, experts have renamed it diabesity.
Type 2 diabetes, which we used to call adult onset diabetes, has marched down in children due to the development of obesity. And there's been about at least a 10-fold increase in the last decade.
But there's good news. Research shows some kids may get off medicine altogether if they can just lose weight.
You are down almost 2 pounds, and it's not even been a full week yet. Congratulations.
Kayani Martin and her mother both have type 2 diabetes. They're getting intensive weekly counseling from a lifestyle coach.
The success that you've had in this program didn't just come overnight.
Kayani lost 12 pounds just by changing a few things in ways that can change the rest of her life.
Choose that healthy lifestyle path and you can save your life. Continue down the path you're on that got you to diabetes in the first place, and eventually you'll fall off a cliff.
Coming up, older people can have either type 1 or type 2 diabetes. They face different challenges and have different needs. Their stories and the new medicines that are making their lives easier.
Type 1 diabetes used to be called juvenile onset. Type 2 used to be called adult onset. We now know different. Type 2 can affect kids. Type 1 can affect adults. When older adults have diabetes, they face different challenges. They need different treatments. And they face different dangers. 65-year-old Bob Jackaman has not let type 1 diabetes slow him down.
I play tennis 2 or 3 times a week. I walk 4 or 5 times a week.
Bob has been living with the disease for almost 40 years. He's finding that the challenges of a working adult are different from those he faced as a kid.
I was on a business trip at the time, and I passed out.
Bob's insulin shot had actually driven his sugar too low.
These ups and downs and these swings where either the patient or the doctor can't really figure it out carries the term brittle.
At first, that meant 10 to 15 tests of blood sugar levels a day.
I am so sensitive to insulin.
He used to have to take 4 to 6 injections a day.
That all changed when Bob got the insulin pump. He inputs what he eats and the amount of exercise he does. The pump gives him the insulin he needs and keeps his sugar from getting too high. What has not changed are the occasional lows.
I could drop down to 30 in a matter of an hour.
Then what happens is you start having mental status changes and you don't think as well.
I was driving erratically. My wife helped me off the road, and I went to the hospital, and as it turned out, I was in shock. It was a real rude awakening as to how unforgiving the disease can be.
Unforgiving if it's not controlled. Studies show diabetics control the condition better if they have partners on or off the court.
Live your life. Enjoy it. Have fun. There's nothing that you can't do.
That's a credo Eva Barquero lives by.
1, 2, 3.
She developed type 2 diabetes when she was 18. Many people think that's milder than type 1, the type that Bob has. But in some cases, it can be just as dangerous. Eva had a stroke.
A real devastation in our life.
I got very angry first and depressed, but I wasn't ready to quit life.
The road to recovery was long and difficult. Weeks in the hospital, months in rehab, and frequent visits to the doctor.
That pushed towards me very good, very strong.
At first, like everyone with type 1 diabetes and some with type 2, Eva needed insulin shots. She also took what many type 2s need, pills that make the body more sensitive to its own insulin.
These medications help the cells in the body to utilize the glucose that's in our blood more efficiently.
Eva takes one of the newest medicines called Actos.
1.
When she lost 200 pounds, everything changed.
I don't inject myself because I don't need to.
It wouldn't surprise her doctor if Eva got off pills as well.
Today she does everything that one without diabetes does. She's truly a role model for diabetic patients.
Life deals you a lemon, you have to make lemonade of the lemons. And that's what I did.
Coming up, what Caden Kessel did for his diabetes in our nation's capital, and what many people are calling finally the potential cure.
Remember 7-year-old Caden Kessel? He wants to be a professional football player. Unfortunately, he has to wear an insulin pump.
My friends sometimes say it's the coolest thing on earth. And I say, well, not unless you have diabetes.
Caden wants a more permanent solution.
All right, good job.
So he traveled to Washington, D.C. with members of the Juvenile Diabetes Research Foundation to meet members of Congress.
He's been an activist pretty much from the time he got diabetes. He is somebody who likes to walk up to people and educate them.
And educate them, he and his family did.
You sort of never get over that newborn phase of being a parent. It's like you're waking up every 2 to 4 hours every night, and that just never ends.
Hard to hear, and even harder to turn Caden down.
We're going to make sure that this disease is a thing of the past. Because
Yeah.
we're so
Thank
close. We're so close. You know, it's just going to happen.
But we've got to put more money into research.
As soon as I get cured, I'm going to throw my pumpkin in there and bat it with the baseball bat.
That may be much closer than Caden thinks, thanks to people like Jerry Alley. Jerry was diagnosed with diabetes at 18. It was so severe that it caused problems with family, friends, even work on his farm.
I was very unpleasant to live with because I was worried and financially stressed. My former wife just, I don't think, could handle it anymore. She couldn't deal with it. And so she took the kids and left. A couple of little jobs that I got, I'd have seizures, and the people just couldn't deal with it. Finally, the last one, the manager saw me fall off the horse as I was bringing cattle in. He carried me down in convulsion, and that was my last job. I eventually lost the farm. I lost everything.
Hopeless? Until Jerry's doctor told him about islet cell transplants.
And he had been saying, Jerry, I think this is going to be the thing that's going to work for you.
The doctor had been studying the technique since its infancy in a pioneer technique at St. Vincent's Hospital in Los Angeles in 1993. Insulin-producing islet cells were taken from a cadaver, then placed in a pouch that was surgically implanted in the abdomen. It worked. The islet cells started making insulin, but over time they fell victim to the same thing that causes type 1. The body started attacking the cells with its own antibodies. Immune-blocking drugs helped, but many of those patients needed 3 or 4 transplants. The technique Jerry would get was a far cry from those early operations.
We introduce a catheter into the liver through the side of your chest, and we guide that catheter into a major blood vessel supplying the liver.
The hope was that more cells would survive to make more insulin. Jerry needed only 2 transplants. After 4 decades of waiting, he says they were easy.
They kept me for a night, and then I was able to come home.
When he tested his sugar for the first time after the transplants, he was stunned.
To look at those blood sugars and see normal, within range, 80 to 120 now, is amazing. I still can't believe it.
It's kind of like a rebirth, you know? So I'm really excited for him. I'm really happy.
It's a miracle, and it's so much potential for so many people.
Potential? Jerry and his daughter were warned the result might not be permanent. Over time, if some of his new islet cells die, he may start needing insulin again, though in far lower doses than before. Experts at City of Hope and many other centers around the country, though, say we've cleared the first barrier. New approaches may take us even further. A recent study in the Journal of the American Medical Association suggested that adding other techniques to the islet transplants might prevent rejection and improve the chances of success.
The stem cell certainly provides an unlimited source of supply for islets or insulin-producing cells for everybody who has diabetes.
A permanent cure for everyone? Only time will tell. Jerry says the time he's already gotten is more than enough.
I have more future than I've had in 41 years. At age 60, I feel like I have a second chance. I have an opportunity to have a life again.
Almost every single diabetic that we spoke to echoed Jerry's thoughts that even a day off insulin was worth the world. Studies on stem cell and bone marrow transplants are already underway. The epidemic is real, but the future is bright. If you or someone you know has diabetes, these new tests and treatments can help to live a long and healthy life. For resources to help you do that and a full script of the show, go to our website at KMBC.com, click on Health and the Diabetes link. I'm Dr. Bruce Hensel. Thanks for watching.